Are you confused about when to introduce peanut butter and eggs to your baby? You're not alone. I'm Dr. Tracy Tyson, I'm a board certified general pediatrician, and there's some relatively new guidelines since 2017 to help parents, pediatricians, and health professionals give more guidance. So, first and foremost, prior to 2008, pediatricians used to recommend delaying the introduction of peanut butter until the age of 3. They also delayed the introduction of eggs and other foods that might be more likely to induce allergies in children until after the age of 1. Around 2008, we started to realize that this guidance was not scientifically backed and it actually could cause more harm than good. Took a few years to get a really good study, but in 2015, a LEAP study was performed which showed that the earlier introduction of peanuts in children who were high risk reduced their risk of allergies. So this opened up a huge difference in the way that we introduce solids for kids. So here's what you do. If your child does not have a strong family history, does not have severe eczema, you want to introduce peanuts and eggs at age of 6 months. How do you do this? There's a few different ways. You can do thinned out peanut butter. Peanut powder is a really good way. Sometimes I start by just kind of dipping your finger, putting it in your child's mouth, letting them taste it a little bit in a few days, introduce it again, in a few more days, introduce it again. I like to then continue peanut powder because it's a really great way to add to Greek yogurt or oatmeal to increase the protein and fat content in your child's food with less sugar. Eggs, the best way is to do mashed up boiled egg because cooked egg is the best way to go, and that way you'll know for sure how the child does. Do the egg white first, then the yolk, double check. What are signs you might notice of allergies in your child? There could be a rash, there could be vomiting, diarrhea, or a cough. Those are really rare when you introduce them early, and they're going to be really subtle the first time that you introduce them. So if you have any questions, please talk to your healthcare provider. We also offer other resources. Sometimes in really nervous families, we'll allow them to introduce them in the office. I even have families who introduce them in the car in the parking lot so they can be really close to us if there's a problem. So I hope this helps. Introduce those foods early. The studies only showed statistical difference in peanuts and eggs. However, we do recommend not withholding any allergenic foods such as strawberries, shellfish, peanut, eggs, or gluten until after a year. We want them getting them in early and often. Cow's milk can be introduced under a year of age. Obviously, baby's formula can have cow milk protein, but we don't recommend full milk for babies as a source of nutrition. They can have yogurt, cheese, and other forms of dairy. I hope this helps. Drop some questions in the comments if you have any. Take care.